Hi there, my lovelies. Hope you guys are doing well and staying safe. Today, I have a very important topic to discuss with you. It's, of course, androgenic alopecia, more commonly known as male pattern baldness, and the 50% rule associated with it. If you're concerned about hair loss and simply want to understand the science behind it, then you are in the right place. And before I start, don't forget to subscribe to my channel and hit the subscribe button right now. Do it now, okay? And notification bell to stay updated on all the future content. So now let's get started with the topic of androgenic alopecia and 15% rule. Let's begin. So, first of all, androgenic alopecia. I have been talking about this for the past year or so. I have brought you different topics. As you know, I was diagnosed with androgenic alopecia. I went through a lot of stress associated with it. Then I gained most of my hair back, but then COVID hit. So that's all I'm going to talk to you about my progression right now. If you want to know more about my journey, hair loss journey, how I gained most of my hair back, please check out other videos I have regarding androgenic alopecia. So let's start. So as you know, androgenic alopecia, it's a hereditary condition. It runs in the family and it affects both men and women, but it's more common in men. It's linked to genetic and hormonal changes, and specifically the male hormone DHT. And DHT affects hair follicles, leading to the miniaturization of hair and eventual hair loss. Now, let's talk about the 50% rule. What is the 50% rule? This rule states that if you're experiencing androgenic alopecia, by the time you noticed visible hair loss, approximately 50% of the hair in that area has already been lost. This underscores the importance of early detection and intervention. I cannot tell you how important it is to treat the condition early. So if you're concerned about your hair loss, please reach out to your doctor, talk to a healthcare professional. But how do you know you're experiencing androgenic alopecia? In order to reach out to your healthcare provider, you need to know that you are experiencing androgenic alopecia. But how do you know that you're experiencing androgenic alopecia? What are some of the signs and symptoms? Well, look out for signs such as receding hairline, thinning at the crown, and overall reduction of hair density. And it is very important to pay attention to the signs early on to address this issue proactively. For me, I started seeing my part. As you can see, it still became wide. It became wide. I was losing clumps of hair. I wasn't losing this much hair before. That was like the first time it hit me. So as soon as that started, I reached out to my dermatologist, and she addressed this first, as soon as it happened. So that is one thing that is helpful as well. So now let's go in deeper into the 50% rule. So when we are talking about 50% rule, is most likely related to the Norwood scale. So what is the Norwood scale? It is a classification system which is used to understand the progression of male pattern baldness, also known as androgenic alopecia. The Norwood scale is commonly used by medical professionals to categorize the different stages of male pattern baldness. And in the context of Norwood scale, the 50% rule typically refers to the estimation that if more than 50% of hair is lost in the frontal area, it is considered a significant hair loss, which indicates an advanced stage of androgenic alopecia. And this is often associated with stage 3 or 4 on the Norwood scale, where it is noticeable recession of the hairline and thinning or loss of hair on the crown. Hence, it is very important to note that individual experience with hair loss varies by person to person, and the Norwood scale is just one tool among other healthcare professionals use to assess and diagnose androgenic alopecia. And if you're concerned about hair loss, it is recommended to consult with healthcare professional or a dermatologist for a personalized individual evaluation and appropriate guidance on treatment options. Now, what about women? In women, the 50% rule is not commonly applied the same way for androgenic alopecia in women as it is for men. Androgenic alopecia in women typically present differently from male pattern baldness. In women, androgenic alopecia can lead to diffuse thinning of the hair across the scalp rather than sudden distinct or different or specific pattern of hair loss that is seen in female. I did not lose like a different weight. I just lost hair all over. So it just became thin. However, a scale known as the Ludwig scale is often used to classify the stages of female pattern baldness or female hair loss. And this scale is not based on a specific percentage rule like the Norwood scale of men, but it is characterizes the severity of hair loss in women into 3 stages. For women hair loss, the Ludwig score or the Ludwig scale describes the severity of hair loss in 3 different stages. So there's stage 1, which involves mild to moderate thinning, usually concentrated on the top of the scalp. Stage 2 is, in this stage, there is more noticeable widening of the midline. When you part, it's more, you can see more hair, scalp, widening of the midline part, and increased thinning on the top of the scalp. And then there's stage 3. This stage is characterized by extensive thinning across the top of the scalp with little to no hair remaining in some area. That is a very severe case. And if you're concerned about hair loss, it is essential. It is very important to consult with a doctor with a healthcare provider or dermatologist. They can assess, they can examine the specific situation you are in and determine the underlying cause of the hair loss and provide appropriate guidance to potential treatment or management strategies tailored to your own need. So for me, I went in early. They gave me the different treatment option. I chose the treatments. I described my treatment in detail, how I managed my hair loss. And I'll just go over it, give you another summary of what are some of the options. There are different types of options available. For androgenic alopecia, it includes over-the-counter medication called minoxidil. It's like you can put it topically in your hair, on your scalp, and in the affected areas. And then there's prescription like finasteride and spironolactone. And there are options to slow down the hair loss. In some cases, it promotes regrowth. Additionally, advanced treatment like hair transplant can be considered for more significant hair restoration. So it is essential to consider lifestyle factors that may contribute or increases the androgenic alopecia. Stress, poor nutrition, lack of sleep play a big role in hair loss. Taking steps to manage stress, maintaining a healthy diet, and ensuring adequate sleep can contribute to overall hair health. Prevention is key. If you have family history of androgenic alopecia, consider starting preventive measures early. It includes using hair care products designed to strengthen and nourish hair, maintaining a healthy lifestyle, seeking professional advice at the first sign of hair loss. So, in conclusion, understanding androgenic alopecia and the 50% rule can empower you to proactively take the steps to address hair loss. If you found this video helpful, give it a thumbs up and don't forget to share it with anyone you think who might benefit from this video. Remember, early intervention is crucial, is very important when it comes to preserving your hair. Thanks for watching, and we'll see you in the next segment. Until next time, take care and bye. Happy viewing.